we're starting off with this slide tonight because that is why we're here. If you look at the picture of the students, that was about 2 years ago. It was before we even really heard of a thing called the pandemic. And our kids are happy, they're smiling, we can see their smiling faces. That's why we're here. We want our kids to be in that state every single day in this school district. So we're here tonight, and joining me is our Health Services Coordinator, Deb Mayer. And we're here to present to the school board and the community the 2021-22 COVID-19 Operational Plan for students, families, and visitors to schools. And so again, I just want us to hold these kids in our hearts as you hear the plan and have the total affirmation that that's the reason that we are presenting some changes, because we want to get back to that reality. So our goals for this year are to continue to provide a safe and inclusive learning environment, to mitigate the spread of COVID-19 in our school communities. We want a successful launch of our 196 online school. From the pandemic, we quickly put together an option for families who choose to have distance learning for an entire school year, and so that's an important part of our plan as well. And most importantly, we're here because we want to maintain in-person learning all year to accelerate academic growth for each and every student in this district. So our timeline, last March 2020, was when the COVID-19 peacetime emergency began in Minnesota. And we spent, and several of you in the room joined us for many long meetings. Summer 2020 was really devoted a lot to looking at protocols, but also to looking at what were those learning models. Were we going to come back in distance learning? Were we coming back in a hybrid model? Was there a plan to get back in person every day? So we spent last summer focused on that. This summer in July, the state recommended that districts follow the CDC guidance, and so that's what we did, and we put that out to our public. A couple of things have changed in the last few weeks. One is that I'll restate this. One is that it's become apparent throughout the nation that this is a decision that our country has left to local school boards rather than to other government or regulatory agencies. The other and the most important is in Dakota County, the COVID variant numbers continue to accelerate. And so for those reasons, we've updated, also in August, we had that initial plan on our website. We had public comment at that time. Today, we have a revised plan that we're requesting school board approval for. So the feedback on the operational plan has been extensive. We had the draft up for just a week in August and had many, many people read through that plan. Over 3,000 responses were submitted to that website. We've had hundreds of emails, voicemails, social media comments. We've had speakers at school board meetings. We've reviewed the plan with our District 196 Restart team, which is combined of teachers, administrators, and building principals, and we've also had our COVID-19 teams looking at it. And now, as always, we're in continual consultation with our public health partners. So now, I'm going to turn it over to Deb to explain some of the data, and also she'll walk through the first half of the plan, and then I'll finish up the last half and provide the recommendation to the board.
Thank you, Superintendent Krieger. There we go. This is our local case trending data for Dakota County. This is data that's available on the CDC COVID Daily Tracker data website. You can see that they just kicked this off in July. In the middle of July, they started aggregating the data nationwide, so we have consistent data points that we're all looking at across the country. You can see that when we started in July, we were in the moderate level of community transmission. By July 1st, we were up to substantial, August 14th high, and we continue high. The data reported today, we were at 141.48, and that is also in the high category of community transmission. When we started working on our plan in July, as we realized that we were responsible for figuring this out, we were in that moderate range, and we were very, very hopeful that we would be able to have a different start to this school year with less restrictions, less requirements, and more seeing of faces. That was our hope. But things changed. The circumstances in Dakota County changed with the variant, and we are responding based on that. This is what our new dashboard will look like on our district website. You can see that our 7-day case rate per 100,000 residents is 141.48 again. We are in that high transmission level. Our current vaccination level is 66.4% of our eligible residents. That's everybody that's 12 and older. They are fully vaccinated. We will continue to update our dashboard every Thursday with this information. You can see that it changed when the Safe Learning Plan sunsetted. It changed from that 14-day case rate per 10,000 residents to the 7-day case rate for 100,000 residents. Again, that's the consistent data point that the country will look at. We are rising just like the state of Minnesota and the nation. We recognize vaccinations along with testing, layered preventative strategies, and community engagement are important to ensure sustainability of in-person education for our kids. With that, you can see that we are partnering with Homeland Health and the Minnesota Department of Health to offer on-site vaccination clinics starting this Monday, August 30th. The first one is at Apple Valley High School. These clinics will include the school-required vaccines, the polio, diphtheria, tetanus, all of those that have always been required, and the recommended COVID-19 vaccination. Again, these are voluntary. For the school-required vaccinations, parents are able to complete a conscientious objection form with a notarized statement, or they can also get a medical exemption for those. Your nurses will be working with you to figure out your plan for the upcoming school year, but do feel free to participate in these vaccination clinics. They are available for our whole community, so we're excited about this partnership. Again, testing is one of those mitigation strategies that's so important for us. If we know somebody is positive and they isolate, we prevent that spread and that community transmission. So we do encourage regular testing for COVID-19. We are not doing any COVID testing at our school sites for students or for staff. We had that opportunity to opt in or opt out last week, and we opted out. We will continue to provide information for families on testing that's available within our community on our district website, or you can reach out to any of us on the COVID team or your school nurse, and they'll be able to help you with that too. We've been talking about this. I know you're probably sick of me talking about community responsibility, but we really are all in this together. This has been a tough stretch. I don't know of anybody that's coasted through this last 18 months. I know that a lot of us have given up things that we enjoy. We're trying to figure out how we can do this and get back to a sense of normalcy. Our primary objective, as Superintendent Krieger said, is to keep kids in person every day, all day. And we think that this proposed plan that we have before you and the changes that we made since we initially rolled out fall is the way to do that. With that, it's important that the community engagement and community responsibility, we all step up and do what we can. Want you to stay home when you're sick and get tested. We report all COVID-19 cases we want you to report all positive student cases. We're not interested in the family cases this year. Last year we were required to attend to our entire community and do contact tracing all across the board. That has gone away with the Safe Learning Plan sunsetting, but we do want you to continue to report positive students. And then we are required to report those to the Department of Health. Get the COVID vaccine when you are eligible. Anybody 12 and older is eligible for the Pfizer vaccine, and again, you can stop by one of our on-site vaccine clinics next week. Use caution in participating in large group activities. I know I'm a lot more lax this year than I was last year with the changes in our community conditions and community spread. We just all need to look at what we can do and how we can do things safer. Please do follow the MDH decision tree for people in schools, youth, and child care programs. These are some resources that are available on our District 196 website. As we see how this goes tonight and what our board decides to do, we will update our operational plan for students, families, and visitors if that's necessary. We will get those updates out to you, our community, as quickly as we can, and update our dashboard, like I said, weekly. We still have the decision tree posted on our website, and how to handle a positive case, and the best practices that are available. And our testing sites for the state of Minnesota, we will keep those up to date as well. So Superintendent Krieger, she talked about our overall COVID objectives for the 21-22 school year. She talked about the feedback that we received from our plan posting initially. And I talked about our current county data and local data. Also want to tie that, we talked about community engagement. That's all kind of for all of us and our big plan. When we look at our overall operational plan for District 196, these sections have remained the same throughout our pandemic planning process, and we will get into each of these a little bit more, remembering that our primary objective is to have kids in person all day, every day. So the first part of our plan describes the assessment and handling of illness. Much of this has stayed the same, but much of it is markedly different. If you are ill or experiencing COVID-19 symptoms, we still want you to stay home and follow the decision tree. That's a recommendation. If a student tests positive for COVID-19, we do want you to report that to the school. The student should stay home and isolate for 10 days. That's all still true, similar to last year. The school will send a message to families of other students in the positive students' classes or programs so that families will know that there was an exposure. We will not do a general notification to the whole school or to the whole community. It will be specific to that child's program or classroom. The good news, here's the part that's the big kicker and quite a bit different from last year. Potential close contacts do not need to quarantine if they are vaccinated and or wearing a mask. So with the proposed changes that we have for our operational plan, we anticipate minimal contact tracing and minimal quarantines, thus meeting our goal of keeping kids in-person learning. The next part of our plan discusses masks, and I know that this is a, oops, did I do that? Oh, so masks we know help achieve the goal of keeping students learning in school. Again, we don't have to quarantine with exposures if we're all masked. The decisions that we make regarding masks are based on the local transmission data and CDC's transmission matrix. That the data points that I had up earlier are from the CDC website. This is the matrix that accompanies that set of data points. The low spread is less than 10, moderate spread is 10 to 50, substantial is 50 to 100, and high spread is greater than 100. As you know, based on the data points that we shared earlier, we have been in the substantial and high spread now for a few weeks. So masks will be recommended indoors for all people 2 and older when the Dakota County COVID-19 transmission rate is low or moderate, and that is up to, actually, it's 49.99 cases per 100,000 residents. The masks would be required indoors for all people 2 and older when the Dakota County COVID-19 transmission is substantial or high, and that's 50 or greater. Again, we've been there now for a few weeks. Changes from the recommended to required, or vice versa, will be made after case rates remain at the higher or the lower level for at least 7 consecutive days. Again, our whole point is trying to keep kids in person learning. We know that another critical strategy for mitigating spread is social distancing. CDC was very specific, though, when they addressed social distancing in their most recent recommendations. It is not to interfere with full in-person learning. Last year, as you know, with the Safe Learning Plan, we had to consider our spaces and how do we keep people 6 feet apart, it started with, then it was 3 feet apart is good enough. Now it's we need to get them all in person, so it's really important that we continue to layer those mitigation strategies so that we can do that safely and keep kids in. Again, maintain at least 3 feet from others whenever possible. Students will be asked to allow for distancing on buses and in the cafeteria whenever possible. Each of our buildings is set up a little differently, so each building will figure out how we can do that the safest. Floor markings and signage to promote social distancing will still be on building walls and in learning environments. We will limit visitors and volunteers during the school day when the community spread is substantial or high. The next portion of our plan addresses hygiene and cleaning practices. We established those quite well in the last 18 months, and they will continue with regular hand washing and proper hygiene, emphasized. Hand sanitizer stations are throughout all of our buildings. We have HEPA filters in every classroom district-wide, and we will continue with our regular cleaning and disinfecting of learning spaces and our buses. Food and nutrition services. The meals for the 21-22 school year are free for all students that are attending school in person through the USDA funding. This does not apply for students that are homeschooled or those that are in our one of our online classes. The mealtime health and safety measures that we have implemented include scannable meal IDs that have replaced the keypads that we had in our cafeterias. We'll keep classes together whenever possible, alternate seats whenever possible. We have single-use silverware available. HEPA filters are in the cafeterias as well as in the learning spaces, and we will continue cleaning and disinfecting between meal times. Transportation, that's another place that we do actually have a federal order in place. Masks are required when riding buses to and from school and for all school-related activities. That, you may have noticed, last week they extended that federal order. It was supposed to sunset or expire in September, and now it goes through January. We will have our windows and roof hatches open when weather is permitting, and buses will be cleaned and disinfected regularly. I'd now like to turn it back over to Superintendent Krieger. Thank you.
Thank you. I'll finish up with the rest of the plan. So technology and internet access. This is another area where we are so fortunate to have the community that we do in District 196. When the pandemic hit, we were already well positioned with technology. And at this point in time, every student has access to district-owned learning device. We have technical support available for students and families. We have dedicated support for our District 196 online students and families. We have hotspots available for students who need them to have reliable internet access, and we have voice amplification systems available in our classrooms as well. So as we think about this last several months, we are all very aware of the impact this pandemic has had on our social and emotional well-being. I think when we look at students coming back to school in person, we're concerned. We know that they will have an increased need for support in the area of social emotional learning and just basically mental health and well-being. So some of the things that we put into place, as all of you parents know, we have next week an early start to the school year. We have our student success days for secondary, we have our assessment days at elementary, and we have a different kindergarten protocol as well to support that building of relationships, mental wellness, having students enter the buildings, get accustomed to that space that they may not have been in for a long time. We also have excellent teachers and administrators who support our students in this way. And if students need extra support, again, because of our community supporting a referendum in 2019, we do have specialized mental health support in the form of school counselors, psychologists, social workers, and nurses to help provide those extra layers of support for so many of our students who will need that coming into the school year. And online, on our website, we have many resources that will help with self-regulation for students and some specific for dealing with the trauma and the trials and tribulations that have been this COVID-19 period of time. So be sure to access those and see if there's some there that may help you and your family. Finally, the last part of our learning plan is looking at athletics, activities, and enrichment. We follow the Minnesota State High School League and district guidelines. We have activities in school in line with this plan, as well as community use of district facilities if they're following the district health and safety protocols. So those are the key components of that operational plan. And now we are before you, the school board, with this following recommendation. It is to approve the 21-22 operational plan for students, families, and visitors to schools and authorize the superintendent to update the plan as needed throughout the school year with notification to the school board. If approved, face masks will be required in all District 196 buildings effective Monday, August 30th, 2021. The use of face masks will be adjusted to recommended when the COVID-19 transmission level in Dakota County, as measured by the CDC's transmission matrix, drops to moderate for 7 consecutive days or additional guidance is provided. And the reason for this recommendation, and I think it's important for us to look at this plan as a whole, all of these components come together so that we can continue to educate our students in person at school every day of this school year. We know that they will thrive and be well if we're able to do that. And with that, I thank you.